5, and I just wanted to thank you, Amy, for joining me today. I know that we started talking because you were interested in myofunctional therapy, and I try to learn and get involved with as much stuff as I can with gut health, and I kind of have my own journey with that stuff. But why don't you tell us a little bit more about how you came across me, and then we'll kind of go into this 2-part interview thing that we've put together where today you're going to interview me, and then on another day, I'll interview you. So yeah, tell us kind of how you got started on this stuff.
Oh yeah, so I am very into functional medicine and things like that. So I was actually listening to Mike Mutzel's podcast, which was excellent. And so that kind of got the wheels turning in my head, like maybe I have myofunctional issues. So then I kind of deep dove. Yes, exactly. So then I deep dove into like your site and some of your YouTube videos and was like, oh, I think I definitely do have myofunctional issues. And so I reached out to you, and during our consultation, we kind of nerded out a little bit about like the vagus nerve,
Totally.
and how and how myofunctional therapy can help with vagus nerve function and also digestive function. So then, because I run a site that talks about digestive function, particularly about SIBO, and which is very brain gut related. So vagus nerve is so important in that particular condition. So all the wheels were spinning when we were talking, and I was like, a lot of people that suffer with SIBO and chronic digestive issues are not looking into myofunctional therapy at all. So I really wanted to do some sort of collaboration with you because this information needs to get out there, because a lot of people are kind of missing something that could be an underlying cause for them. So
Definitely.
that's kind of how I got into it, and why I want to like ask you some of these questions, because I think it could be really important for people in the digestive world, because a lot of people aren't talking about it. So
no, I agree. And a lot of people in my world aren't really making these bigger picture connections. A lot of us are very dental oriented, so we're always focused on the mouth, but we're not necessarily focused on, well, okay, what about, what happens after we chew our food? And that's really been a lot of my interest recently, just making all these full body connections. And I love functional medicine, so I'm really happy that that's kind of your background too. So yeah, let's dive right in. So what's your first question?
So maybe just explain a little bit about what myofunctional therapy is, and kind of what the goals are, and like who's a typical patient that you see, or who needs myofunctional therapy.
Yeah, that's a perfect introduction. So I work with people who have dysfunctional habits for their mouth and for swallowing. So it sounds kind of funny to focus on these things that I focus on. These are all things I always kind of joke and I tell people we shouldn't need a therapist for these things. We should actually do these things naturally. And if we're not doing these things naturally, the things that I'll tell you about in a minute, we are existing and living in a state of dysfunction. And it's so basic, it's so simple, but if we don't actually do these things, it creates a ripple effect of negative health consequences. So what are these things? My 4 goals when I work with people are, number 1, you have to breathe through your nose all day and all night. And that doesn't sound like a big deal. And most people might think, oh yeah, I breathe through my nose. But really, pay attention to yourself. A lot of people don't breathe through their nose. And this happens usually because we have allergies or breathing issues as kids. And then that habit of mouth breathing sets in. And by the time we're older or we're adults, that habit is pretty strong. And most people don't even know they're doing it. So that's goal number 1. Goal number 2 is that I need everyone I work with to have a good lip seal. So that means your lips rest together. It should go hand in hand with nasal breathing, but it's just a different way to look at it. Goal number 3 is your tongue has to be up fully in the roof of your mouth. And this is where the vagus nerve comes in, and we'll be getting more into that later. But I always show people this little mouth here. So if this is your mouth, your tongue, if you're breathing through your mouth, it learns to rest down here. and I need your tongue to be resting on the top, making those 3 points of contact. So the middle, or the front, middle, and back. This is where your tongue needs to go inside your mouth. So three-dimensionally, your tongue needs to fill up the entire space of your mouth. If you feel like there's a gap of air between like the top of your mouth and your tongue like this, you're not making that contact. So that's goal number 3. Goal number 4 is I need you to swallow correctly. So people who historically breathe through their mouth or who are tongue-tied will often swallow dysfunctionally. And I definitely want to get into more about tongue ties and stuff soon too. But most people I work with have something called a tongue thrust swallowing pattern, which is an infantile swallowing pattern that we've retained for whatever reason. We haven't developed a mature swallowing pattern. Usually it has to do with mouth breathing, but yeah, if we're not swallowing correctly, we're not engaging that vagus nerve, this is a big deal. So although it seems like really, really simple, basic stuff, a lot of people don't have these 4 goals naturally accomplished, so they need to work with someone like me. So now you know.
And I feel like it's almost like maladaption. Like we're adapting to something, but then it becomes maladaptive in the long run. Because it might be something short term where like you had some sort of lung infection or something as a child or something.
Exactly. It can be so simple. Yeah, asthma is one. If you have asthma, you're very likely to feel like you can't take a deep breath of air. A lot of people had asthma when they were kids and then they grow out of it and their breathing is fine as an adult, but they have that leftover mouth breathing, low postured tongue habit, and this is what affects them later in the life. And honestly, the more these symptoms go on, the longer they accumulate, and we develop like ripple out dysfunctions in other parts of our body based on just our tongue not being in the right place and not swallowing correctly or breathing correctly. So yeah, it's a really big deal.
Yeah. And I think that a lot of people might come to you with like more breathing issues than anything, but they have lingering digestive symptoms. Usually, like maybe that's not the direct reason why they come to you. Can you kind of explain what sort of GI symptoms you typically see in your patients?
Yeah, a lot of people who come to me don't even connect the digestive thing. So this is why I think there is, like you said, a whole group of people who are really on the digestive bandwagon who aren't looking at this stuff. So, you know, that's the hard part, is sometimes I don't even get a chance to talk with people about the digestive side. It's more like an afterthought. A lot of times I'm working with people who they come to me because they have sleep apnea. And this is a big one. So just as a side note, if you're a mouth breathing kid, you're basically guaranteed to be an adult with sleep apnea. So a lot of people who come to me have airway issues. And like you said, they probably do have gut issues. And honestly, they probably do have vagus nerve issues. And they have a lot of stuff going on. So if they come to me for sleep apnea, that's one thing. Orthodontic treatment is another thing. A lot of people who have mouth breathing and tongue ties and these habits, they've got narrower palates, they've got longer faces, and they've had changes to the shape of their jaw and the structures of their face. So a lot of times it's either cosmetic, or they need jaw surgery, or they're looking into braces. So yeah, the gut side of things, I'm excited to talk about. So
yeah, exactly.
Yeah, let's see. What was the other part of your question? Oh, what the GI symptoms. So when when I see people, a lot of times they have, pretty typical stuff. Acid reflux is a big one. So I connect a lot of this to air swallowing. So swallowing air is just one part of it. Obviously, there's a lot more going on, but when people don't swallow correctly, they often swallow air. So if they've got a tongue thrust swallowing pattern, they can't breathe well, so they're chewing their food less effectively, or probably not enough, and they're possibly chewing with their mouth open, and they're kind of gulping down their food. Not It doesn't have to be that obvious. We all kind of do that when we're really hungry or when we're in a hurry, but this is to the point where every time they eat and drink, they're taking in little bits of air, and that alone can affect the digestion, of course. So that's a symptom: acid reflux, bloating, gassiness, stomach cramping, just generally not feeling great. And again, a lot of people never make these connections until I start to ask about it. And, they've never really noticed that they feel bloated and gassy and not so great every day. But then I ask them about it and they're like, yeah, actually, I do have stomach aches a lot. I've just never really thought of it before. So depending on where they're at in their health journey, maybe I'll talk about this, but maybe I've got to kind of focus on, they're trying to deal with the sleep apnea or the jaw pain or the dental aspects of this stuff. So it's, when you're looking at the whole body, it's always trying to figure out how do I help people, with these things that they're concerned about, but then also help them see the bigger picture. Some people aren't at the point where they really want to look at all this, because it is like, going, what's the joke? Like down the rabbit hole, the more you learn, the more there is to learn. And sometimes people are like, oh, I just want the easy answer. So it's not always easy. Yeah.
Awesome. I know kind of in our consult, you mentioned some of your patients also having like certain chemical or sensitivities to different foods. So do you see that a lot? So like gluten issues or stuff like that?
Yeah, well, it's hard to say. I do ask about this a lot. I ask people all the time, have you ever tried changing your diet to feel better with digestion issues? That's usually a sign to me that somebody's on that track. They've looked into gluten or dairy, or they've been tested. To me, it's more of like a red flag that, okay, they've started looking into this and maybe they have had digestive issues simply by the fact that they say, oh yeah, I've tried cutting out gluten. Usually if people have gone down the gluten road, then they've started looking at some of these other things. So it's kind of like the tip of the iceberg, I guess, when you start looking at gluten. But there can be a correlation. I think it's more with inflammation. So I was a kid with allergies, and I had a lot of these myofunctional issues myself that I've had to work through. And I do wonder if that allergy response that I had when I was younger kind of kicks off certain inflammatory markers or inflammatory responses in your body. And then, although I don't experience seasonal allergies now, the reason I started looking into a lot of this gut stuff was because I started getting skin rashes and I could not figure it out. And eventually I got into, figuring out that, oh, maybe it's a leaky gut symptom. And so I know that they're like more like a collection of symptoms. I don't necessarily know that there's a direct cause of like, oh, if you have myofunctional issues, you'll have food sensitivities. But I know that they definitely go together, overlap, they're connected. But it's like chicken or the egg. And it's actually, like I said, a collection of problems. So does that make sense?
Yeah, so it's kind of like a red flag more so than like a correlation at this point.
Totally. Yeah, definitely.
Awesome.
Yeah.
Yeah, so I guess like I kind of want to jump more into like vagus nerve stuff. So
Sure.
vagus nerve is like such a hot topic in the gut health world. I know you said not as many people are talking about it in your world, but obviously you're talking about it. So that's
Yeah.
But in the gut health world, the vagus nerve is so crucial to activating your parasympathetic nervous system, which kind of triggers that rest and digest response. And so it brings like enzymes into the gut so you can digest. It brings blood flow. It stimulates motility. And so like that's huge in the SIBO world. And a lot of people that have SIBO, their main issue is vagus nerve deficiency, vagus nerve weakness, which causes something called migrating motor complex deficiency. So it kind of creates this issue where things aren't being cleared from the small intestines quickly. So I know that you talk a lot about tongue positioning and how that stimulates the vagus nerve and helps strengthen the vagus nerve. So I was hoping we could talk a little bit more about that.
Yeah. And after we spoke initially, I was like, gosh, I better, I've heard dentists talk about this, I've heard people mention it, but I'm like, I better like do some researching and really get some facts straight and make sure that I can like legitimately talk about this. So I started looking into it deeper to figure out, what does the tongue position actually have to do with the vagus nerve? And it comes back to swallowing. So we know that the weak swallow and problem swallowing can be connected to vagus nerve function, but I think a lot of people don't really know why. And this is where the tongue posture comes in. So your tongue should be resting in the top of your mouth where I showed you those 3 points of contact across the whole top. If you're doing that, you've got good tongue tone, throat tone, muscle strength in your throat and tongue. And then when you swallow, you're having a functional swallowing pattern. If your tongue is low and sitting in the bottom of your mouth and you swallow, you're going to have a weak swallow and a dysfunctional swallow. And this is where the vagus nerve stimulation won't get. I doubt it's not being stimulated at all. It must be stimulated. I think it's just not getting the full benefit or the full effect that it should by a correct swallowing pattern. So the high resting tongue posture it goes hand in hand with the functional swallow. So, but there's a lot more to it. Like I wasn't super familiar with that migrating motor complex, but I talk a lot about peristalsis, and I think that they're either the same thing or very connected, right?
They're very, very interconnected, essentially.
Yeah. Yeah. So peristalsis starts when we swallow, and that wave-like motion that ripples with a smooth muscle, it starts in your esophagus and goes all the way through your entire digestive tract. So if you're swallowing with a tongue thrust swallowing pattern, we call it a reverse swallow. Your tongue is actually pushing the wrong way. So it's kicking off that whole motility, that peristalsis, in a not optimal way. I mean, it still works. Obviously, people with a tongue thrust can eat and swallow, but that muscle function is not as effective or as good as it should be. So, I mean, that's definitely one connection. So the tongue posture and having the high tongue in the back helps the vagus nerve with the swallowing. It, swallowing correctly helps that peristalsis action. And then this is where I think I see a lot of problems is tongue ties. So there are some people who have a physical problem with their tongue. The midline of their frenum, the frenum that runs down the midline of the tongue, is too tight or too short. And for these people, I think this is where you really start having like double whammies, triple whammies with health problems, because there's a specific gene mutation. That MTHFR gene is responsible for causing the tongue tie defect, and it has a lot to do with epigenetics and all these really big topics. And there's lots of there's tons of, what is it called, SNPs, or
SNPs.
There's lots of versions of that defect, is kind of like the layman's term way of explaining it. It's not just like there's one problem. There can be many defects and many problems through that MTHFR gene mutation. So this, I think, that MTHFR gene is also connected to gut issues and increased inflammation and autoimmune issues. So if you're tongue-tied, not only do you have trouble swallowing, which is one vagus nerve issue, you have problems with tongue posture, you've already got a higher risk for having some of these gut issues based on that gene mutation. And there's a whole other topic we haven't even got into, which is mouth breathing. And some of the the things that mouth breathing does is it kicks you into that fight or flight response. So it's like opening up a big can of worms, right? So the tongue, the breathing, the swallowing, like I said in the beginning, it's so basic. We should do all of these things correctly. And so some people think, why do I need a therapist to learn how to chew and swallow my food and how to breathe through my nose? But that's exactly what people need help with. And it's not like this is the only therapy you need and there's nothing else. It's just connecting all of these other things like what you're looking at. So is there anything you want me to elaborate on with that stuff? I know I just kind of like threw a bunch of stuff out there.
That was awesome. I have a couple things. So you were talking about like each swallow should really, I guess, be stimulating that parasympathetic response. So if you think like that's telling your body that you need to digest like each time you're swallowing, so that's just a little bit mind-blowing. Like if you're spending your whole life not swallowing correctly, you're not getting the correct signals that you need to digest.
That's exactly right. Yeah, that's exactly right. And it's setting off the smooth muscle peristalsis in a not optimal way too when you have that swallowing pattern. So yeah, there's a lot to it, but I think people who are tongue-tied and tongue ties, if you're in my world, this is becoming like a really big thing. I was talking about it years ago, like 6, 7, 8 years ago, and I sounded crazy for talking about tongue ties. But now it's kind of like the new modern health trend is like, is your baby tongue tied? And we're looking at it as kind of like something that babies need. Like, oh, if you can't breastfeed, then you need to have your baby's tongue tie released. It's a lot more than that.
Yeah.
There's a lot of babies get missed, or maybe they're bottle fed, so the parents never know. But if you're a child or an adult with a tongue tie, you're setting up the digestive tract, for having issues. And I think when we're kids and when we're young, we could get away with so much. If you're 10 years old and you've got a lot of these gut issues, a lot of times kids, they either don't display symptoms or they don't feel anything. And then you have it go on for chronically for 20 or 30 years. And then this is when people almost have like a health crisis, right? So I think it's an accumulation of a lot of things. The breathing stuff that I mentioned, being in fight or flight for a long time, for many, many years, it's all like intertwined and interconnected. It's not just like the swallowing or the gut. I mean, it's one and the same, really. And then, you can wrap in some of these other big things like sleep apnea, which is, if you're a mouth breathing kid, you're bound to be an adult with sleep apnea. And it's a whole other issue. So, but yeah, we'll keep it gut related for this topic. But yeah,
Well,
you go.
yeah, so kind of to elaborate on that. So you have all these people that get stuck in that like sympathetic fight or flight. When
Mm-hmm.
you start kind of working with them and they start to get kind of more into that parasympathetic rhythm, do they start to feel better? Like how do their symptoms kind of resolve? Like what kind of things do you see? What improvements do you see in your patients when you can kind of make that shift, both digestively and then just holistically?
Yeah. So the things that I mostly focus on, and I should start kind of tuning into more of these other things a bit more. I'm just trying to think of how to integrate it, but I always want people to start feeling like they're more well rested. So this relates back to the sleep apnea thing, and we always connect it to, oh well, you're sleeping better at night, so you feel better. But now that you're saying it, I bet a lot of that has to do with getting into a more parasympathetic state versus sympathetic. So if you're in that more rest or digest, you're going to sleep better. So, even if you're breathing better and your sleep apnea symptoms are improving, I bet a lot of why that happens when I can get people to breathe through their nose and keep their tongue up. Yes, I know it relates to the airway and a couple other things, but I think the vagus nerve stimulation has got to be, it's got to play a big role. That's just my feeling and my sense of connecting all these dots. But yeah, people usually they should. I hope that they start to sleep better and feel more well rested. I like to track digestive issues and see those become less and less frequent. I do see changes, and it's hard to say for sure with everyone. Not everyone's going to have like, oh, my symptoms went away, because most of the time I'm working with people, they're not trying to change their diet, they're not taking probiotics, they're not doing a lot of the things that if they did, they'd probably have more changes.
Mhm.
But the one thing that I know that I can eliminate for people is air swallowing. I know this can be, completely done away with if they learn to swallow correctly, and that alone can help people's digestive issues resolve completely, or at least get better. I do work with people who it doesn't, and then I know there's more going on than that. Obviously, there's never one root cause. There's always like many strands of causes that all connect. So, yeah, acid reflux should get better. Um, Bloatiness, gassiness, not feeling great should get better. Sleep should get better. If people have jaw pain, clenching, grinding, headaches, neck and shoulder tension, that should get better. Uh, yeah, teeth, a lot of what I do, since my background is dental hygiene, is focus on the mouth. So gum health is better. You're less likely to get cavities if you breathe through your nose versus your mouth. So there is a connection with the microbiome in the mouth
Mhm.
and the healthy bacteria levels versus unhealthy bacteria levels that you have in your oral microbiome as you swallow. Those go into your gut, those go into your the digestive tract, and that affects our gut microbiome. And so yeah, I mean, there's so many ways of looking at it, and I can't say, oh yeah, do myofunctional therapy and it will change all of these things, but it does affect a lot of parts of our body for sure. Um, I think breathing is like the most basic human function. You know, if you're not doing that correctly, then I mean, good luck with everything else, right? So
Yeah. So let's talk a little bit about uh, the role of nitric oxide in nasal breathing and
yeah,
how
yeah.
some of the kind of important functions that can play both in the GI tract and also systemically or in the whole body.
Yeah, nitric oxide is a super critical molecule. I've been reading so much about it lately, and I think it's like you said, we were nerding out before. I'm totally nerdy about nitric oxide. I think it's like it's so cool. So, but when it comes to mouth breathing, this is where things go wrong. So you breathe through your mouth and you don't use your nose. Well, it doesn't sound like that big of a deal, except your nose produces nitric oxide. So in your nose, in your sinuses, every time you take a breath and you breathe through your nose, nitric oxide goes out into your body. It basically gets flushed through your system when you take a nasal breath. So when you're mouth breathing, a couple things are going wrong. One, you're missing nitric oxide. And two, when you're mouth breathing, you're shallow breathing. So you're not getting um, deeper breaths into the deeper parts of your lungs, like the far down lobes of your lungs never get air. So you're not breathing good, you're not getting the right, nitric oxide molecules into your body. And then also breathing through your mouth is kind of like the body's emergency, like I've got to run away or I've got to fight. It puts the body into fight or flight when you use your mouth to breathe. So this is obviously not good. So mouth breathing, we've got to breathe through our noses to get nitric oxide and to get into parasympathetic. When you breathe through your nose, you breathe deeper. You get nitric oxide, and you get better delivery of nutrients to your body. I think it's like if you breathe through your nose, you get like 10 to 15% better oxygen utilization in your body. So mouth breathing is kind of one of those like recipes for disaster. So yeah, I feel like I'm going on a tangent. What was the exact question?
It was about nitric oxide. I feel like you
Oh
covered
yeah.
it really good.
Yeah, well, nitric oxide, I got a quote from an article because it does relate to the gut too. I saw this research article and it says nitric oxide is known to have a protective effect on the GI tract. In studies, it's been shown to help maintain gastric mucosal integrity. So this is good. This is really important. It helps. It also says something about it helps inhibit leukocyte adherence to the endothelium, and it helps to repair NSAID induced damage. So aspirin, Advil, Aleve, that kind of stuff. If you do have damage, it can help repair that, and it helps maintain that gut lining, which is so important.
So
But it's a molecule that's responsible for blood pressure regulation. What else? Like fighting off bacteria and viruses and our immune health. It helps with pain regulation, and I think it even relates to like ATP production in like mitochondrial health. I don't know for sure on that, but I'm pretty sure it's involved in that whole process. So, and then one really cool thing I read about it a while back that I thought was pretty cool is it almost behaves like a hormone. So, we have like endocrine cells. They call nitric oxide a aerocrine molecule in a lot of discussions about it. So, aero meaning air, aerocrine, the way it behaves in the body is very similar to a hormone and not just like an extra molecule that's floating around in our bodies. So it's very, very interesting, and we need it for health for so many reasons. And it's so simple. If you breathe
yeah,
through your nose, you get it delivered all to your body. And so, to me, all this stuff is so common sense, but we're so far away from like common sense in
yeah,
modern medicine that we miss all these little tiny things that are critical. So,
yeah. And I think like it's important to note too that like when you breathe through your mouth, you don't get any nitric oxide, do you? Or very
no,
limited.
No, unless, I mean, it's got to be produced in other parts of the body, and I know you can get it from certain foods, but you're missing a huge amount of it if you breathe through your mouth. So,
Yeah, that's so cool. All
hmm
right. I feel like that pretty much sums up everything I had, but like where can people find out more about myofunctional therapy? I know your website's awesome. You have awesome YouTube videos.
Yeah, I started an Instagram channel too. I'm trying to post,
Wow.
up there. But yeah, I've got YouTube videos. I've got a really helpful website that I try to post information like this. I'm happy to work with people online. I do online myofunctional therapy, so I meet with people just like this. I do video calls, and it works great. There are lots of myofunctional therapists out there, though. I would say probably most of them aren't looking at this kind of stuff, but that's just kind of me being like extra nerdy. But there are the field is growing. Tongue ties are really important. I would encourage people, if they don't know what a tongue tie is, but they know they have that MTHFR gene mutation, like they've had their genes tested and they know they have this, look at your tongue. If you can't elevate it, and I'm actually working on designing like self assessments and stuff like that, so people can look at some of these things on their own. But if you think you're tongue tied, you're going to have all these things that I'm talking about: the mouth breathing, the low tongue, the swallowing issues. And you don't have to have a tongue tie. I would say it's like 50-50. I never had a tongue tie, but I had all these issues. I was just a mouth breathing kid, and I had to learn how to change my habits as an adult. Um, about 50% of the people I see have a restriction of the frenum underneath their tongue, and this needs to be corrected through surgery. It's a very, very simple surgical procedure, but it does require exercises before and after. So don't just go tell your dentist, oh, I have a tongue tie, can you laser it for me? You've got to make sure you do it the right way. Your muscles have to learn how to be used in new ways. So if you've been tongue tied your whole life and your tongue physically can't move the right way, swallow the right way, you can't speak. And I'm not saying like you can't do these things, but you've developed dysfunctional muscle compensations, and people end up recruiting a lot of other muscles from their neck and throat and below, like the whole floor of the mouth. They have these dysfunctional compensations, and they end up with a lot of head and neck and shoulder issues because of it. So just having the tongue tie released is very like the tip of the iceberg. You've actually got to learn how to strengthen the muscles and use the tongue and rest the tongue properly, rather than just lasering the tongue and being like, okay, I solved that problem. It's not that easy. So
Well, I think too, a lot of people, when they think of mouth breathing, they think of just the obvious, like, oh, I'm not mouth breathing. But even just
Mhm.
like mouth breathing at night can be a problem, a huge problem too, and be an indicator that you might need myofunctional therapy, even if you're not like openly mouth breathing all over the place.
Totally. Yeah. And a lot of people are kind of not intentionally in denial of it, but we get so used to just how things are with our own bodies that we don't necessarily tune into it that closely. But even if your lips are apart like a millimeter, that means your mouth is open. So it doesn't mean you have to be like gaping,
Yeah.
wide open mouth, tongue hanging out. It's nothing like that. It's the lips part. And if your lips are apart, your tongue will always drop to the bottom of your mouth. And sometimes because the tongue is in the bottom, that's why the lips part. And you don't actually have to breathe through your mouth. You could be breathing through your nose, but your mouth is still open and your tongue is still low. So there's a spectrum of all these things. It's not like you have all of them all the time and it's the worst case scenario. A lot of people have variations of these symptoms and different combinations of these things. And but I love what you're talking about with the SIBO and gut health people kind of missing this side of it, because I can relate. I think the dental people are really missing that side of things.
Oh yeah.
So I think, we're joining these things together and hopefully connecting a lot of dots for people. That's what I'm hoping for.
Oh yeah, definitely for sure. This has been awesome. I don't
Yeah.
have any other questions. I don't know if you have
Okay,
anything
cool.
to say.
Yeah, I think I'd love to hear, can you tell us about your blog a bit and what you're doing and kind of I think, are you in school? I can't remember.
Oh yeah, I'm in school. I am wrapping up school. I've been in school forever. So finally wrapping that up. I'm going to be a dietitian after I take the exam. So
Exciting.
That's the goal. I should be hopefully doing some consulting at some point in the future. But I do have a blog called the SIBO Diaries that I try to write as much as I can on, but I've been pretty busy the last year or so with doing a dietetics internship. But what I write about on that blog is mainly about SIBO and about just functional approaches to SIBO. There's a lot of misinformation, so I kind of try to keep it common sense, but then coming at it from a functional approach, keeping it pretty science-based. But yeah, it's a lot of fun. I love writing, so.
Cool. Well, we should definitely, I mean, I know we're going to do part 2 of this interview, and I get to ask you a bunch of questions, so I'm looking forward to that. Yeah, I mean, we should definitely collaborate more in the future because, like I said, we're trying to bridge these gaps, and yeah, I'm excited to see what the future holds for you as a dietitian as well. That's super exciting.
I'm pumped too.
Yeah.
And it's just really fun to connect the dots too.
Yeah, I think so too. I mean, this is like my life, is trying to like figure out all this stuff, and I think you can relate. So, you start with one thing, like, I was a dental hygienist, and I just kind of started going down this path of like, what about this tongue stuff, and now what about the breathing, and what about the tongue ties, and now, the gut health and sleep apnea, and yeah, it's a lot, but it is a lot of fun. So
yeah, it's crazy when you dive into the functional world how many things actually do connect. You're like, well, I have to consider this, I have to consider this, I have to consider this, but it's very exciting, at the same time when you can make those connections.
Yeah, totally. Well, let's stay in touch. Let's keep spreading the word, and yeah, I guess we'll just wrap it up. Yeah. All right. Well, I guess let's just call it a day, and then we'll meet again. And I'm just going to kind of drop a little bit of a preview. I want to ask you more about the fecal transplant stuff. I know that's kind of like a big thing, and so that's definitely, I think it'll be kind of like planting a seed for a lot of people. Like, what is she talking about?
We can talk about fecal transplant. That's always fun. I love talking
like
about
a teaser,
Oh man.
All right. Well, thank you so much, Amy. We'll be in touch, and we'll be talking again soon. So thanks everyone for listening to this video too. All right. Bye.